Welcome back to my channel. In today's video, I am going to conduct an in-depth biomechanical analysis on the structural differences between men's feet and women's feet. One of the biggest misconceptions about these differences is that they simply relate to size. However, current clinical evidence has shown significant anatomical gender-based dimorphism. Through this video, I will be comparing and contrasting male feet and female feet by way of a podiatry lens, while looking at the ways in which forefoot geometry, ligamentous laxity, and integration into the kinetic chain affect our overall biomechanics. The understanding of these differences are crucial for anyone who wants to learn about the scientific aspect of human motion and or injury prevention. The most significant morphological difference between male foot shapes and female foot shapes lies within the relationship of the forefoot to the hindfoot. Studies using anthropometrics have shown that while both male and female feet have similar dimensions when expressed relative to total length, male feet have significantly wider heel bases, hindfoots, and much thinner metatarsals, forefoots, creating a wedge shape. In contrast, female feet generally exhibit an opposite form factor. They have narrow heels, hindfoots, but wide toes, metatarsals. Therefore, the geometric disparity between female feet and conventional shoe designs can lead to higher pressure levels at the toe pads, which can lead to increased stresses at the distal ends of the first through fifth metatarsals. These stresses are commonly associated with common podiatric complaints such as bunions, hammer toes, and neuromas, which occur with greater frequency in females than males. Furthermore, we have to make some considerations regarding the difference in the joint laxity of male feet and female feet. The study results showed that female feet usually have greater ligamentous laxity in the midfoot and ankle region as compared to male feet. Thus, female feet require a better neuromuscular control during the stance phase, whereas male feet, which possess a tighter structure, shift more pressure on the joints. It is essential for the orthopedic surgeons to consider the biomechanical peculiarities of each patient's feet when choosing orthosis for men and orthosis for women. Finally, the addition of the foot to the kinetic chain demonstrates that male feet and female feet are subjected to different forces. Due to the sex differences in the pelvis, the Q angle is different, which affects the direction of the force from the hips to the feet. In short, the force transmission on the feet follows different patterns for males and females. For instance, the force transmission in females tends to push the medial column of the feet, whereas it is minimal in males. This information explains the increased prevalence of stress injuries among the female feet as compared to the male feet. In summary, the anatomical differences in male and female feet are complex and multifaceted. From the unique structure of the forefoot to the implications of the kinematic chain initiated from the pelvis, these factors serve as critical areas of research for scientists in the field of sports medicine today. By studying the differences in the range of motion or, conversely, the increased rigidity of the lower limbs, researchers can identify ways to prevent injuries. Thank you for watching. Please like, share, and subscribe to the channel.